All right, good evening, everyone. My name is Dr. Gogu, and we have Dr. Ben Moses here, who's running for the House of Delegates in Virginia. We're very lucky to have Dr. Moses here on National Doctors Day, where he's a critical care anesthesiologist, and he's running for the 59th District in the House of Delegates in Virginia. So thank you for having us, Dr. Moses.
Thank you so much for having me. I'm very excited to be here for this conversation with Doctors in Politics. It is Doctors Day. I'd like to thank all the people out there who are at the bedside, taking care of our sick and our family members. I know it's been a very long year through this pandemic, and I know that I know what it takes to be there. And so I'm really grateful for all of our partners in medicine who've been at the bedside through all of this. Thank you.
Yep, thank you. So we're real excited, to have more physicians, running for political office, especially during this time where, this pandemic was really a gross mismanagement at the political level, to be quite honest with you. And so kind of wanted to ask you kind of what inspired you to get into the political realm as a physician?
Sure. I've had, a kind of a passing interest in politics for some time, but working where I work in Central Virginia, even before the pandemic started, I got more and more familiar with the issues that people have accessing healthcare and maintaining their health inside and outside the hospital, and realizing that there were a lot of factors that go into play. It's not just whether or not you have the right doctor at your side in the hospital, whether or not you have access to nutrition, whether or not you have access to safe housing, whether or not your kids have access to good education about health and healthcare starting from the age of kindergarten. It's about ensuring that we have good infrastructure everywhere so that when people get sick, they actually have a way to get healthcare. And these are all things that, I can only do so much inside the hospital, but realizing that I want to have as great and long-lasting an effect as possible, I wanted to get into this political realm as a doctor so that I could take the experience that I have, both my 10 years as a military physician and my experience as a critical care doctor and anesthesiologist, really to help set policies that make sense and take care of people as people, not just as an illness or as a patient.
Fantastic. Yeah. So could you speak a little bit more about what was it like for you, with your experience doing military medicine? Because that's a very unique background that not many physicians really have.
Well, I was on active duty for about 6.5 years. And some of that time was spent taking care of soldiers in preparation for deployments. But a big chunk of my time on active duty was spent taking care of soldiers after they'd come back from war. And in that time, taking care of people and their families when they were trying to reintegrate either into the military system or because of their injuries were transitioning out of the military into the civilian world, really crystallized for me the difficulties there are for people when they've had, in some cases, severe injuries or chronic injuries. Especially, we dealt with a lot of mental health injuries or mental injuries, psychiatric injury. These are things that affect people not just for a short period of time. It's not a bone that breaks and then heals. These are people who are affected probably for at least a long period of time, if not the rest of their lives, and finding ways that they can be supported by the system as they leave the military and go into the civilian world. A lot of people remember the difficulties that we had in the VA health system, and it's gotten a lot better over the last number of years. But I was on active duty during that time when we were transitioning people into the VA system. So seeing that we have multiple integrated systems of healthcare designed to help people, but don't always do a great job of close handoffs, of ensuring people's safety, of ensuring that not just they have access to medicines, but they actually have access to support and ways to ensure that they have a good plan. So much of what we did when I was working at the Warrior Transition Battalion was making sure people had a good plan. And that is something that I think translates exactly to what we're looking at right now. In order to take care of a lot of people with a big problem, you can't go into it with just a wish and a prayer. You have to have a plan. It doesn't take a miracle. It takes a blueprint. And that's really, I think, per your point, what you're saying, what we're seeing with the pandemic and how much of a struggle it's been for people across the country. It's not because people aren't trying to do well. It's not because politicians want people to be in harm's way. It's because we didn't have a good plan, or we did have one and it was kind of chucked.
Yeah. One of the things that I really loved, reading your website and trying to get to know you is how you define healthcare. You always talk about health justice, and I think that's a term that not many people politicians really talk about. It's a term that really physicians really understand. And particularly when you look at the COVID pandemic, particularly the Black and brown communities that have been out there really haven't had the health justice that's there for them. Because if you look at outcomes, among those communities, particularly communities of color, their outcomes due to COVID have been far inferior compared to other groups. So could you speak a little bit more about when you talk about health justice, what do you mean by that? Because I think you have a really good definition.
Sure. So when I'm talking about health justice, it has to do with the way both we diagnose and treat people, the way we support people and their families, and a lot of the implicit bias that goes into our system. So I'm an ICU doctor. I try to practice evidence-based medicine every day. But if you even look at the evidence that we use how to practice medicine, if you look at the research that so much of our practice is based on, it's based on biased approaches to science. When I'm talking about health justice, I'm saying that we need to be practicing medicine with an eye on finding those biases, rooting them out, and ensuring that we're not passively waiting for things to get better, that we're actually actively trying to focus on how we correct those things, how we own the fact that medicine has been flawed for a long time, specifically with biases. And I'm talking about racial bias in medicine. It is absolutely a real thing. There is gender bias in medicine. There is race bias in medicine. There is economic bias in medicine. There's language bias in medicine. These are the things that no matter what it might say in a textbook, no matter what the correct surgical procedure might be for a certain disease is, those of us who are at the bedside taking care of people have to recall, or we have to recognize that I've got my own eyeballs and I see what I see, including my biases. So if I'm going to be the best doctor I can be, I have to understand my biases. I have to examine them. I have to try to work against them. I have to really focus on what it is that's right in front of me, how I can do the best thing I can for the person, the human being right in front of me. And then I have to expand that into a system. As a system, we have to look at the ways that Black and brown people in this country, especially in this country, it's not exclusively an American problem, have been adversely affected. In the COVID pandemic, it is 100% fact that Black and brown people who have been affected more severely, worse outcomes, longer hospital stays, higher mortality rates. And now, since the advent of the vaccine, we've seen, unfortunately, worse access to vaccinations across the country. These are systemic problems. These are things that we cannot wish away. We have to say, this is real. The way to get through this is to acknowledge it and look for ways to specifically combat these biases, these systemic biases. That is what it means to practice health justice.
Yeah, that's absolutely true. And we as physicians, that's really what we stand for in Doctors in Politics. Like some of our pillars, are quality healthcare for everyone in the United States, education that's designed for whole child development, racism dismantled from our institutions, climate change, women's medical decisions free of politics, and really gun violence that's studied as a public health crisis. One of the things I really noticed also, that you took a pledge in is the Clean Virginia Pledge, which really is like you're not going to accept any campaign contributions from like the utility companies particularly. So could you speak a little bit more on why you think that's important, particularly as a physician, because a lot of people don't see the intersectional lens between climate change and health. And I think you saw that very early on.
To be clear, there's a couple reasons to take that pledge. One of them is a simple legal reason. If I'm running to represent people, I'm also running to work in Virginia state government. And Dominion Energy is a state-controlled entity. entity. So taking money from an organization that I would then have the power to control in the state government, it represents a very powerful conflict of interest. And I think it's really unethical, the number of people who do take a lot of money from that organization. That said, the current energy environment in Virginia, a majority of the energy that is used in Virginia is still based on non-renewable resources. And the fact is that when we're burning coal, when we're burning natural gas, we are harming our environment. Environmental toxicity is directly linked to health outcomes. This is science fact. There's no question about this. So when we're talking about environmental health and also health justice, what we have to recognize is that in order to have policy that leads toward the most healthy outcomes for all people, we have to look at the ways that we get and maintain energy. We need to be looking at clean energy sources, clean energy networks, redundant energy sources. The fact is that Dominion Energy has not prioritized, and a lot of other organizations also have not prioritized sustainable energy that does not come at a cost to human health.
Great, great. I wanted to ask you as well, are there any skills that you think you've gained as a physician that you think really translate well to your future work as a politician?
Yes. Sorry, short answer there. I think that what has been the most useful for me, especially as an ICU doctor, is the ability to spend time with a person and a problem and listen and pay attention to the trends and pay attention to the information and really try and get from people what the issue is. I'm used to taking a lot of different information at one time and trying to come up with the best, safest solution for, at times, dozens of people all at the same time. Really that ability to integrate several critical pieces of information at once and come up with a plan on how to get to the next safe space. That's a skill that I think is missing in a lot of politics today. The ability to listen and actually take a lot of information and be critical, really have a critical eye and make hard decisions to ensure that safety is always the number one priority.
Great. We also have some questions from Facebook users, and I'm just going to kind of read them out to you. One of them is like, how are you different from physicians serving in Congress like Rand Paul? I think you've answered that, but I'll have you answer that again if you don't mind.
In addition to the fact that I'm running as a Democrat and Rand Paul is most certainly not a Democrat, I'm a practicing physician. Rand Paul stopped being a practicing physician a long time ago. My goal in entering politics is not because I want to transition fully away from medicine. In fact, one of the best things about the House of Delegates, the General Assembly in Virginia, is that it's made up of servant leaders who are still working in jobs all across Virginia. My plan is to serve Virginia as a delegate in Central Virginia, in addition to continuing my medical career in helping people lead healthy lives inside the hospital. I think that's one of the big fundamental differences. There's also the fact that my eye toward health policy really is more of a justice lens. It is much more, as we've already talked about, integrating all of the issues that go into a person's health and looking at that from systems-based issues. I'm not worried about so much one person or one organization or one entity having the best tax breaks. I'm focused on what's going to make sure the most Americans, the most Virginians, have safe access to education, have safe access to healthcare, have broadband internet so that they can engage in all the wonderful things that currently allows us to do, including jobs. I think fundamentally, the only thing similar between Rand Paul and me, besides the fact that we were both cis-het white men in this country, is that we have MBs after our names. But as politicians, we could not be more dissimilar.
Yeah. A couple other questions. What will you do to convince those members across the aisle to follow the data and science in making policy decisions, which has been really difficult currently?
The approach that I take is the same that I would with any friend. The reality is, all I can do is have a conversation, tell people what I know to be true, wait for them to ask questions, and answer those questions honestly. I can't expect anybody to automatically assume that what I say is fact. I can't expect everybody to believe exactly the same thing that I believe. What I can do is try and hold the space for people and try and meet them where they are. It doesn't always come at making a huge leap. Sometimes it's little by little.
Yeah. A couple other questions is, what is the state of healthcare, of the healthcare system in the area you want to serve?
Unfortunately, it's not great. There is one primary care clinic in my entire district. There was another one that recently closed. I think last year it just closed. I think that the greatest health challenges in my district are with primary care as well as dental health care. There's a drastic deficit of dental health resources across the district. In order for people to get to anything beyond the most basic primary care involves at least an hour drive in any direction outside of the district. So really finding ways to connect people with those resources is one of my main priorities.
Gotcha. Someone asked, what are your top policy priorities?
So really boiling it down to the nitty gritty. Number one is health access in my district. Number two is education. Number three is broadband. And I cannot say that they're in any one specific rank order. The reality is that they're all interrelated. I'm a father of 2 children that are in public school here. I know that you can go 20 minutes away from me south into another county, and the education resources that kids have there are so different. And the broadband is so poor that in order to just do homework, sometimes kids are having to drive or get driven to a gas station to use their Wi-Fi to do homework. You cannot have health equity without having health education, without having good nutrition in schools, and without having broadband access. It is ideal in complex systems, ideal in interrelated systems as a physician, as a critical care doctor. And the fact is that these things are interrelated. You cannot have a conversation about one without having a conversation about the other. I think that it's going to take time. It's going to take agreement that there is a problem that needs to be fixed, and it's going to take a plan.
Absolutely. And then since we're almost at the 15-minute mark, so I'll leave it for one final question here. The last question is, dismantling structural injustice requires representation. How will you support women of color to run for public office?
I am very much a fan of, at the very least, a couple of different women of color that are currently running for office inside Virginia. Delegate Guzman running for lieutenant governor. I think that she's running a wonderful campaign. Former delegate Jennifer Carroll Foy running for Virginia governor. I think she's running a wonderful campaign. I think Senator McClellan is running a wonderful campaign, and I'm so excited by their races here in Virginia. I think I can say with confidence that if somebody inside my district who was a woman of color told me that they wanted to run for this seat, I would probably be supporting that person, because this is a time when we need more people who don't look like me running for politics. But the fact is, I have the experience, I have the expertise, and I have the drive and desire to do this hard work. Some of my mentors throughout my career have been women of color. My ethics mentor is a woman of color who's the chief of diversity and inclusion at Hennepin Health System in Minneapolis, Dr. Neka Cedarstrom. She's one of my closest friends and somebody that I seek for guidance all the time. We've even talked about her going into politics one day, and I can't wait for her to jump in and really fully support her. I think that there is not a Virginia or an America that survives the current time that we're in without representation in government, without representation in leadership in all organizations. I think that we do need to dismantle the white male patriarchy that exists in this country. And unfortunately, I'm speaking against myself on that. But I'm ready to do the work. I'm here for it.
Well, we appreciate it. This conversation just flew. I can't believe we're at the 20-minute mark. But,
oh my God.
Yeah, I know. But thank you so much, Dr. Moses. We really appreciate it. I know we as in Doctors in Politics are really proud to support and encourage more doctors to run, for state and federal office, because at this moment, I think we're uniquely positioned to champion the best care for our patients and be a driving force to heal, America's healthcare system. So we're really excited about your run, and we're really going to be there behind you and supporting you. So thank you so much. And
thank you, Dr. Gogu. I appreciate it.
Yep. Thank you. Thank you so much. Thank you, everyone, for tuning in today. Take care.